Hello, everyone. Welcome to one more fresh episode of our podcast show, which is Life in Progress, the personal and professional stories. And today we are back with one more very interesting episode. And I should not call it an episode, rather, we are doing a series on this particular topic because this topic is of relevance to almost every one of you. If you are getting long hours of sitting in your offices, long hours of working on your system, so that you are having back issues, neck issues, frozen shoulders, and many more such kind of issues, because of which you are bound to visit the physiotherapist. Yes, that is becoming a lifestyle issues nowadays. So today we are inviting our guest, and she is a physiotherapist. She's taking classes in the university for various physiotherapy courses at undergrad and master's level. She's doing her practice as well in this particular domain, in this particular area. And she would be breaking certain myths about physiotherapy. She would be bringing a lot of clarity about this topic. And that's the reason we thought of creating a series of multiple episodes on this particular topic. And our today's guest name is Dr. Srishti Banerjee. She would be talking a lot about this topic. But if you are new to this channel and you have not subscribed to this channel, so yes, you can, because we keep on bringing various topics of interest to everyone on this particular show, which is telecasted on every Friday. So let's welcome our today's guest and let's know everything about this very important topic, which is need of the hour, that is physiotherapy. So let's welcome Dr. Srishti today. Yeah, so hello everyone. As I was sharing with you, today we have our guest, physiotherapist, Dr. Srishti Banerjee with us. And before we start asking a lot of technical questions and go deep inside to this topic, first of all, welcome Srishti to this particular session. I'm really grateful that you agreed to discuss in detail on this topic, which is actually a need of the hour. But before we proceed to our discussion, I would just like you to give us your brief introduction, and specifically, I want to know that what inspired you to take your career in this particular domain, that is physiotherapy, because that's not an easy career path.
Right. Thank you so much, ma'am, for having me. This is actually a very great platform to talk about this topic. So, if I talk about physiotherapy, I did my bachelor's. I started in 2012, and the inspiration behind pursuing this career was physiotherapy is basically a movement science, right? So we treat patients without any medication, without any surgery. So that is the beauty of it.
Hmm.
That was a major reason. It was an inspiration for me to get into this career. And secondly, what happens is, being a physiotherapist, we live the journey with the patient. So it is like we see the patient every day. You undergo a lot of emotional turmoil with them, how they progress, how they are with you at day one, day five, day 10. So that has motivated me that if we go, I will be talking about this in the session, but emotions and your how you feel about a particular thing matters a lot, and physiotherapy is something which helps in catering those needs, because we see the patient day-to-day basis. So I did my bachelor's of physiotherapy, which is a 4.5 years course. Followed by that, I did my master's of physiotherapy in neurology.
Oh,
So it basically deals with patients having brain stroke or Parkinson's, anything which is associated with the brain and the spinal cord and the nerves. So it is a specialization which particularly deals with how you deal with a patient when something is wrong with the brain, or when something is wrong with the spinal cord or the nerves. Uh, Basically, these patients are they come to us for like a year and a half. So that chronicity of the disease, you see actually the phases of
mm.
how from one phase the patient transfers to another one. Right?
Srishti is undoubtedly means I was not having this perspective about this physiotherapy which you are giving, that you are continuously attached with your patient. It's not that
Yes.
you have given something and that patient went and then it's over. That's a definitely, it's a very beautiful thing that you are seeing step by step that how your patient is progressing and how the things are changing in your patient's lives. I can understand, I can correlate with, because I also have gone through once physiotherapy when I had my cervical issues. So I can understand what you are telling. But Srishti, what happens, like if I talk about the common people, how we see the physiotherapy that just do normal exercises under some specific guidance. So if everyone wants to understand that, you definitely have connected physiotherapy with the science of motion, and you are connecting with the emotions of people, but still, what is the basics of physiotherapy, if in a very simple language somebody wants to understand that why we call it a physiotherapy? It can be only a therapeutic option, it's only a therapy, or it could be some preventive as well. What is physiotherapy basically? I just want to
So,
understand. I know I'm asking a layman question, but still.
right, but it is actually the need of the hour, that what is the essence of physiotherapy. So physiotherapy, as you said, it is basically, if you go by textbook definition, physiotherapy is movement science.
Hmm.
Any though we just define it in two words, movement science, it has a lot of layers to it, because when I talk about movement,
Hmm.
it is basically, right, it begins, if you had a surgery or hospitalized, even after the surgery you can move. So
Hmm.
physiotherapy begins there. So if I talk about movement science, and if you see a lot of literature, physiotherapy basically deals from the moment a baby is born till the grave. So that is the essence of physiotherapy. In each and every phase of a person's life, physiotherapy
D
is
to D.
important.
I call it birth to death.
Yes, what to that, absolutely. So, physiotherapy basically is treating, optimizing, preventing any form of injury, any form of ailment, right? So, if we go back in like a decade or a two back, so physiotherapy basically was just that if you have got injury,
Hmm.
you undergo physiotherapy. That was it. But
Hmm.
the evolution in past 2 decades is that we just do not deal with just injuries or just pain or just any form of ailment.
Hmm.
Physiotherapy basically, if I talk about like past recent 2 3 years 5 years, it is basically as a you can incorporate it into your lifestyle. So physiotherapy is basically a lifestyle thing. And it is not just that if you have got pain, you have got fracture, you have got stroke, then you go for physiotherapy. It's not that now. It used to be
Hmm.
previously, but not now. Basically, now it is like to prevent any form of injury, to optimize function during a normal aging process, right? To remain fit, to prevent any form of age-related diseases, specifically when we talk about aging geriatric population. Also, physiotherapy is a core form of intervention, you can say, or a lifestyle in athletic population,
Hmm.
right? They and it is very much different from the regular fitness, like for like going to a gym or doing any form of yoga. It is different because it has found the foundation is different, right? So that is what basic physiotherapy means, that it is optimizing function, be it after injury, be it just for a healthy individual like you and me, or following before any form of surgery, after any form of surgery. So that is what I can summarize about the essence of physiotherapy.
Okay. Srishti, one, when you are telling that it's a routine thing, तो क्या हम फिजियोथेरेपी को ऐसे भी समझ सकते हैं, like, आई एम गोइंग टू माय डेंटिस्ट फॉर अ रेगुलर चेकअप, So is it like that I should visit the physiotherapist maybe 6 months, maybe biannually or annually, to just have a checkup that whether my postures are right, whether I'm sitting right, I'm standing right, am I prone to any kind of ailments or any kind of diseases? Because you have connected physiotherapy with the neurology, and when you are telling that it is related to aging as well, so is it related to my brain aging as well? Means dementia, Parkinson's, वहां भी हम इसको relate करते हैं to prevent those kinds of aging in my nerve cells.
ये सो जैसे आपने कहा, इट इज एब्सोल्युटली लाइक दीज आर द ट्रेंड्स. ये ट्रेंड अभी हम इनकॉर्पोरेट कर रहे हैं कि जैसे आप डेंटिस्ट के पास 2 बार जाते हो साल में, ऐसे फिजियोथेरेपिस्ट के पास भी जाओ तो आप बहुत सारी चीजें प्रिवेंट कर सकते हो.
Okay.
जैसे आई जस्ट गिव यू फ्यू एग्जांपल्स टू रिलेट. Like most of us, even like before COVID also and after the lockdown and everything, we are mostly sedentary in front of our computers, right? And हम कितना भी स्टैंड लगा ले, हम कितना भी चेयर एडजस्ट कर ले, the posture is going to be, you know, misaligned somewhere, right? So
After some time it becomes like this.
yes, because वो comfort position हो जाता है ना, मैं झुक के बैठती हूँ, मुझे अच्छा लगता है.
हाँ.
So those things we don't notice because अभी क्या है ना, that see, like I am 28, so my muscles, my bones are still not in that process of aging, तो वो load ले लेते हैं. But
Okay.
if I'm doing it chronically, five years down the line, 10 years down the line, so when I'm in my mid 30s, फिर वो जवाब देने लग जाता है कि okay, now there is pain and now there is back pain, right? So it is very essential that periodically we visit a physiotherapist to just assess कि भी everything is fine. The physiotherapist will assess your posture, your
Okay.
muscle length, right? The physiotherapist will assess the strength of the muscles, right? कभी कभी ऐसा होता है ना कि अभी आपको symptoms नहीं दे रहे हैं because the muscles are bearing with it, but maybe 2 years 3 years down the line वही posture की वजह से फिर आपको पेन आएगा. So
और
if you,
मे बी अभी आई एम जस्ट एबल टू बियर दैट मच लेवल ऑफ पेन,
yes,
और वो पेन इज बिकमिंग माई लाइफस्टाइल नाउ.
हाँ, right, तो कभी ऐसे बैठे हैं, it is paining, okay, मैंने stretch कर लिया थोड़ा, वो कर दिया, it is better, right?
And
So
Srishti,
we
while you are answering this question, one more point I'm just adding to your answer, that from what age the people should start visiting the physiotherapist, because what I'm seeing in the young children, I should say, maybe the age bracket of 12 to 18 years, the school going students. Earlier, they were not so much supposed to sit in front of the system, but definitely after COVID, हम सबको पता है कि their screen exposure, their sitting in front of the PC has increased. So, what do you
yes.
recommend? From what age the person should start visiting?
अब जैसे as you said, that adolescent age of, you know, from 14 or 15 years, right? Not, I would not recommend biannually or something, but once a year when the parents visit with them, the physiotherapist can just chart out कि भी आपको इतनी इतनी चीजें ध्यान रखनी है, because you know what, this kids they have a very quick healing capacity. वो आपको इतना जल्दी symptom भी नहीं देंगे, right? But to prevent things, it is recommended that at least once a year, or if when the parents feel कि okay, इसका something is wrong this way, भले वो symptom नहीं दे रहा है, but go and visit once, so you prevent a lot of things. And when I talk about biannually or frequent visit, it is very surprising to know that though the mild aging process, but it starts after the age of 25, right? Your bones, if you don't take care after the age of 20, so if you take my x-ray or MRI, if I don't have any symptoms, if I do a MRI of my spine, you will definitely notice some bulging of my disc, right? I'm 28, I'm not getting any symptoms, but my posture is such. I'm in the front of the screen most of the times because I'm an academician. I teach, I do research. Most of the time, I'm in the front of the screen, right? So that is where the problem begins. So if I am visiting some physiotherapist, the physiotherapist will tell you, okay, your posture is like this, your head is forward, you need to do some chin tucks, you need to do some stretching regularly, so that you do not, you're not prone to that cervical issues in future. The same is for back as
Hmm.
well. And when you just said that, what about cognitive or neurological
Yes.
things, right? So there is a solid evidence that any form of aerobic exercises will be running, walking,
Yeah,
swimming,
high intensity
dancing,
workouts.
or high intensity workouts. Aerobic exercises are very, very doable things,
Hmm.
right? You can just take a walk, you can just take a stroll, swimming kar liya if somebody
Hmm.
likes it, treadmill kar liya, cycle kar liya. So
Or
those are
playing
very
any
easy.
sport? Will it be
Or
also
playing
good?
any sport, any form of recreational sport, anything. So it has been backed up by evidence that ये जो आप aerobic exercises करते हैं on regular basis, and you know what, it is not even required that you do it every day. You
Hmm.
do it 3 to 4 times a week, it is more than enough. So this aerobic exercises are associated with reducing the neurocognitive deficits, right? They are helpful in maintaining your brain health. Because eventually क्या होता है ना, कि जैसे आपका बॉडी एज करता है, वैसे ब्रेन भी तो एज करता है. तो we may not notice it up to 45, 50, 60 years of age, but आपको पता है that not everybody gets Parkinson's, not
Hmm.
everybody gets Alzheimer's, right? Obviously they have a genetic predisposition to it, but environmental factors भी उतना ही major role play करते हैं. So it has been established that any form of aerobic exercises, मैं aerobic इसलिए बोल रही हूँ because anybody can do it.
Yes.
You don't need any specialized training for that. आपको किसी कोच के पास या किसी जिम ट्रेनर के पास जाने की जरूरत नहीं है, right? So you can do those aerobic exercises in on regular basis to maintain your brain health.
Wow,
वो
that's
आपका
wonderful.
जो न्यूरो एजिंग प्रोसेस है उसको
Hmm.
रिवर्स करता
Okay. Srishti, one more off the track little because your answers are giving me a lot of insight and lot of
है.
when I discuss with few parents that we are going to have this particular discussion, so that's a specific question from many parents' side, and that's the reason I want to ask you. Nowadays, kids who are sitting in front of system or maybe in their schools as well, the major issues parents are facing is a neck hump. That's the major issues many parents are facing, and that's a one question which I get from everyone's side, that once I'm discussing this topic with you, so is it also definitely the children are sitting like this and they are having the
हाँ.
neck hump, so can it also be reversed by doing certain physiotherapy sessions or physiotherapy trainings? Is it possible? And if yes, then how much time it will take if the person start taking regular physiotherapy session? The age of the kids in the bracket of same, वही teenagers.
Teenagers, वही
Hmm.
12-14 साल के बच्चे. So it is very much reversible. So इसमें there is nothing to worry कि okay ये ऐसा ही रह जाएगा. It is very much reversible, because as I just said that these kids have a very great potential of bouncing back. मतलब healing बहुत जल्दी हो जाता है बच्चों में. So if I talk about a 12-year-old kid and a 25-year-old lady, वो 12 साल के बच्चे का healing capacity obviously ज्यादा है.
Hmm.
So basically what happens is this एक ये posture and this, they are
Okay.
all like onto their phones, right? So this ये जो major predisposing चीजें है, which leads to this neck hump, and basically it is for this kids it is functional मतलब muscular है, अभी bone तक structurally नहीं पहुंचा है. So
Okay.
it is very much reversible. There are a set of exercises depending on क्या कितना hump है, कितनी जरूरत है, and it is doable depending on, जैसे आपने पूछा कि कितना टाइम, it depends कि कितने टाइम से है first, like कितना क्रॉनिक है वो, और कितना इंटेंस है, राइट. सो
Hmm.
आई कैन नॉट जस्ट गिव अ फ्रेम कि 1 month में हो जाएगा या 2 months
Yes.
में हो जाएगा. You go to a physiotherapist, the person will assess, the doctor will assess you and tell you कि ये exercise आप इतने time तक करो and you will see the results. And the best part here is that आपको इन बच्चों में ना बहुत quickly results देखने को मिलते हैं. So if you do a session of 1 week or 15 days, you will notice कि हाँ कम हो रहा है, it is reducing.
Wow.
And which is followed by strengthening exercises and again posture correction, तो वो वापस नहीं आए.
Hmm. Wow, Srishti, your this reply na would have given a sigh of relief to many parents,
I
seriously,
know, I know.
that it is reversible. Okay, now I'm coming back to our main discussion. When you are telling about physiotherapy, so when I was reading about your various articles on LinkedIn and your various posts, so in those I have read that you talk a lot about two important terms. One is rehabilitation and the other is prehabilitation. These words you have used a lot in your articles. This I have read on your various
Right.
posts. So, but before we start discussing this again, I just want to understand the meaning of these two terms. So, when we go deep down into the discussion, the people are able to correlate that what it is basically.
Okay. So प्रीहैबिलिटेशन पहले मैं बता देती हूँ. व्हाट इज हैबिलिटेशन? ये एक्चुअली
Hmm.
हैबिलिटेशन के डेरिवेटिव्स है, रिहैबिलिटेशन एंड प्रीहैबिलिटेशन बेसिकली. सो हैबिलिटेशन इज बेसिकली लर्निंग समथिंग न्यू, right? If I am learning to play a piano, so that is a new skill, that is habilitation. If I am training for a marathon, तो मुझे नहीं आता है, मैं सीख रही हूँ, so
Hmm.
that is habilitation. वो टर्म था जिसपे से ये टर्म्स बने हैं, prehabilitation and rehabilitation. So if we break down the term prehabilitation, so pre is always किसी से पहले, right? It is before something. So prehabilitation is basically before any planned surgery. जैसे नी रिप्लेसमेंट सर्जरी है, उससे पहले का हैबिलिटेशन, दैट इज प्रीहैबिलिटेशन. एंड रिहैबिलिटेशन इज री अगेन, यू नो, यू आप आगे की तरफ जाते हो. सो रिहैबिलिटेशन इज कुछ हो गया, उसके बाद जब आप रिहैबिलिटेट करते हो तो इट बिकम्स रिहैबिलिटेशन,
Can I
राइट.
call it
सो
post surgery?
यस, डेफिनेटली पोस्ट सर्जरी. हाउएवर, ये जो टर्म है ना प्रीहैबिलिटेशन, वो हमेशा सर्जरी के साथ एसोसिएटेड होता है, जबकि रिहैबिलिटेशन जरूरी नहीं है कि हमेशा सर्जरी के साथ एसोसिएटेड हो. इट कैन बी आफ्टर एनी इंजरी, इट कैन बी आफ्टर एनी एलिमेंट, राइट. जैसे स्ट्रोक के बाद आपने फिजियोथेरेपी करवाया, वो हो गया रिहैबिलिटेशन,
Hmm.
राइट. सो मैं दो एग्जांपल देती हूँ जिससे बहुत क्लियर हो जाएगा. जैसे हमने नी रिप्लेसमेंट की बात की, सो
Hmm.
देयर इज अ पर्सन हु इज अंडरगोइंग नी रिप्लेसमेंट, प्लान्ड है, पता है कि बोन टू बोन है, सर्जरी करवानी ही है,
Hmm.
राइट. सो दैट पर्सन इज कंसल्टेड. उसके जब आप 3-4 हफ्ते पहले एक्सरसाइजेस करवाते हो, यू अंडरगो फिजियोथेरेपी, सो इट बिकम्स प्री हैबिलिटेशन. As I am a physiotherapist, I am just talking in terms of physiotherapy, but prehabilitation जो है ना, उसके 3 से 4 component है. It is physical activity, it is nutrition, it is optimizing function, and psychological and emotional support. ये
And
चार
Srishti, all
पैरामीटर.
these four parameters comes under the purview of a physiotherapist?
नॉट नेसेसरीली, बिकॉज
Okay.
देखिए कैसा होता है, जैसे फिजिकल एक्टिविटी है, दैट आई कैन डू, दैट इज माई डोमेन.
Hmm.
बट ऑप्टिमाइजिंग फंक्शन इज माई डोमेन, आई कैन ऑप्टिमाइजिंग फिजिकल फंक्शन आई एम टॉकिंग अबाउट. बट न्यूट्रिशन इज नॉट माई डोमेन, सो यू
Okay.
नीड टू कंसल्ट एन एक्सपर्ट ऑन दैट. इमोशनल या साइकोलॉजिकल सपोर्ट है, कुछ हद तक वो फिजियोथेरेपी के डोमेन में है, हम पेशेंट को एजुकेट कर सकते हैं. बट अगर कॉग्निटिव डेफिसिट्स या clinically anxiety hai, if there is anxiety is clinical, so you need an expert psychologist or a psychiatrist for that prehabilitation domain.
Okay.
So prehabilitation is basically मेड अप ऑफ दिस 4 डोमेन्स, जिसपे एक मल्टी डिसिप्लिनरी टीम काम करती है टू ऑप्टिमाइज द फंक्शन आफ्टर सर्जरी। जैसे नी रिप्लेसमेंट है, हम मैं प्री हैबिलिटेशन में क्या करवाऊंगी, आई नो द पेशेंट इज गोइंग टू गो फॉर नी रिप्लेसमेंट, सो स्टिल आई गो फॉर, जैसे लेफ्ट साइड का नी रिप्लेसमेंट करवाना है, सो वी गो फॉर स्ट्रेंथनिंग एक्सरसाइजेस, स्ट्रेचिंग एक्सरसाइजेस, वी गो फॉर सम ट्रेनिंग ऑफ वॉकिंग, बैलेंस, ये हम लेफ्ट साइड पे तो करते ही है, हम राइट साइड का भी फंक्शन इंप्रूव करवाते हैं, सो दैट आफ्टर सर्जरी द पेशेंट इज वेरी मच कॉन्फिडेंट। सो प्री हैबिलिटेशन का बेसिक मोटो हमारा यही रहता है दैट द पेशेंट इज कॉन्फिडेंट, वी रिड्यूस द पोस्ट सर्जिकल कॉम्प्लिकेशंस, हम हॉस्पिटल स्टे कम कर सकते हैं पेशेंट का, बिकॉज ऑप्टिमाइज, हमने पहले ही फंक्शन ऑप्टिमाइज कर दिया है, तो जो शायद 5 दिन रहता है वो 3 दिन में डिस्चार्ज हो सकता है। सो दैट, एंड द पेशेंट नोस कि ये, जब हम पेशेंट एजुकेशन की बात करते हैं, वी टेक द पेशेंट थ्रू द जर्नी, कि आपका अगर ये सर्जरी है तो ये चीजें होगी, आप ये चीजें फेस करेंगे, एंड फॉलोइंग विच इतने दिन का आपका हॉस्पिटल स्टे रहता है, ऐसी मेडिकेशंस है। सो वी वर्चुअली टेक द पेशेंट थ्रू द जर्नी, सो ही इज नॉट एंशियस कि ओके मेरे साथ क्या होने वाला है, मैं अंडर एनेस्थेशिया होऊंगा तो आई डोंट नो व्हाट इज गोइंग टू हैपन, so that anxiety comes down. And when I talk about rehabilitation, so
Srishti,
taking the
before
same example.
abhi pre-habilitation mein, I have one more doubt, one more question. That who will educate to the patient? For example, किसी को हम knee replacement का ही example लेते हैं. For example, somebody is having this knee issues and the person went to the doctor. So who will advise and who will educate this person that before going to the surgery, you have to visit to the physiotherapist and go for your prehabilitation? Is it the responsibility of my orthopedician to tell me, to educate me that I have to go for it, or I have to self educate myself by watching such kind of series?
This is a very good question. Actually, इंडिया में ना अभी वो रेफरल सिस्टम अभी भी डाइसी है, right? If you have a well-informed orthopedic who has his own team of physiotherapists, who knows, I know a lot of orthopedicians जिनको पता है कि ये हमारा डोमेन नहीं है, I need to refer. मतलब ये प्रीहैबिलिटेशन एक्सरसाइज एवरीथिंग ये फिजियोथेरेपिस्ट ही कर पाएगा, मैं नहीं कर सकता, दैट दोज आई नो दोज काइंड ऑफ पीपल हु इज गोइंग टू रिफर कि ठीक है भाई, आप जाइए, एक्सरसाइजेस करिए, एंड देन वी कैन ऑप्ट फॉर सर्जरी, व्हाटएवर, बट ये परसेंटेज थोड़ा कम है। दिस and actually the concept of prehabilitation is also new here. A lot of people don't know, a lot of people are not very much aware कि okay ऐसा भी कुछ हो सकता है, even a lot of orthopedicians don't know कि हम ऐसा कुछ करवा सकते हैं to reduce the post operative complications.
Because
So
Srishti, whatever you are telling about prehabilitation, it is definitely for the patient's benefit. Or the benefits which I can see here, definitely. The physical, emotional, psychological, these benefits are there. But one more important benefit which I am seeing here is the economical benefit as well. That's a very important
absolutely.
aspect. Because if I'm going
And
to cut down my hospital stay even for a one day, it's gonna have a lot of economical benefits.
absolutely, and this मतलब ये this is actually the need of hour कि हम थोड़ा इसलिए prehabilitation is something I am working on, that we can create awareness, we can my patients, the patients which I see in practice, I do a lot of this counseling and उनके family members से भी, तो basically मैं जितना reach कर पाती हूँ I'm trying, but I think it will take some time maybe to and ये कॉन्सेप्ट को हमको अडेप्ट करने के लिए, सो एंड फिर जब हम रिहैबिलिटेशन की बात करते हैं तो इट इज आफ्टर सर्जरी, राइट? नी रिप्लेसमेंट हो गया, उसके बाद भी a lot of doctors, though they don't recommend physiotherapy after replacements, but it is mandatory. Function की बात करते हैं, so it is mandatory. So I just talked about two examples. ये तो क्या है, ये किसी को हुआ किसी को नहीं हुआ. Not everybody undergoes knee replacement, no. So there's something that I want to talk about is that most of the women will undergo is pregnancy.
Yeah.
Right? तो जब हम प्रेगनेंसी की बात करते हैं, so pregnancy is physiological, there is no ailment. ये बहुत एकदम, it is a natural process, everybody is going to go through, but a woman knows कि कितने changes होते हैं during from the time you have conceived till you give birth, and the changes still. I have talked to women who say हमको at least 3 साल लगते हैं to feel, pre-pregnant हम
To
जैसे
feel
थे.
that strength in the body.
Exactly. So this is what I want to talk here is that अभी जैसे मेट्रोपॉलिटन सिटीज है, मुंबई, दिल्ली, बैंगलोर, यहाँ वहां पे अहमदाबाद, ये कंसेप्ट है, धीरे धीरे डेवलप हो रहा है, बट नॉट एवरीवेयर. सो something which is physiological as pregnancy, there is something called antenatal programs. Antenatal programs is also a form of prehabilitation, because see, eventually you are going to undergo labor. You are going to have some form of surgery. भले आप cesarean section नहीं करते हो, but still, right, there are some cuts, some stitches, कुछ ना कुछ तो होता ही है. So when we talk about pregnancy, ये the time you have conceived, उसके बाद जो 9 months का जो पीरियड होता है, your gestation or pregnancy period, doing exercises is a form of prehabilitation. So it eases your labor. There are studies which show that women doing prenatal exercises are giving normal in sense vaginal, they are undergoing vaginal deliveries and not cesarean sections, because if you undergo vaginal delivery, it is all interconnected. एक तो आपका हॉस्पिटल स्टे कम हो जाता है with a vaginal delivery. You do not undergo complications of anesthesia, you do not undergo the complications of a C-section. Right? So and on the top of it, this antenatal exercises or this prehabilitation program has been associated with reducing the hours of the labor, and the labor का जो pain होता है, that pain, it makes it more bearable, followed by a healthy child. This is all proven, so we have evidence backing it up. Also, जैसे मैंने आपको बोला that prehabilitation, this comes under prehabilitation. Even there are exercises, even there are strategies during labor. जब when a woman goes into labor, तो वो पेन ईज करने के लिए, वो क्राउनिंग करवाने के लिए, सो देयर आर अ सेट ऑफ एक्सरसाइजेस जो एक एंटीनेटल फिजियोथेरेपिस्ट जो स्पेशलाइज्ड है वो आपको करवाता है या आपको सिखाता है कि ठीक है, व्हेन यू गो इन लेबर, यू डू दिस ब्रीदिंग एक्सरसाइजेस, यू वॉक इन अ सर्टेन पैटर्न. आप if I guess a lot of somewhere somebody have seen that वो physio ball है and you sit on the ball, there are exercises which will help the lady to ease up the process, right? And this is a form of prehabilitation.
Yeah.
After you have given birth, right, भले वो vaginal delivery हो गया या cesarean section हो गया, कुछ भी, we know that even after delivery जो changes हो गए body में, वो बहुत टाइम तक ऐसे ही रहते हैं. Right? This you don't, and after the child it becomes very difficult for the new mother कि वो अपने तरफ थोड़ा भी ध्यान दे दे. True. Exactly. But फिर क्या होता है ना, that if you don't take care in this early postpartum period, long term problems रहती है. I'll just give you one simple example. A lot of women who are listening to me will relate to this. that stress incontinence रह जाता है. You do not have a stress incontinence is basically that with uh, laughing harder or coughing or sneezing, a small amount of urine leaks, right? So that is a form of stress incontinence, which is very common with vaginal deliveries. So when you undergo an exercise program after giving birth, that is postnatal physiotherapy, a kind of rehabilitation, right? It is a kind of rehabilitation, so it will optimize your function. So I hope I'm clear with
Absolutely clear.
prehabilitation and
Absolutely clear,
rehabilitation.
Srishti. Yeah, perfectly.
Yes.
Even I was just correlating when he was explaining this prehabilitation and rehabilitation. Though I also work in this domain, that but not the physiotherapist. I'm working as a mindset and life coach. So when I am working with my clients, I work on more the emotional concept and the psychological concept. So certainly I can correlate with this term which you are using, the prehabilitation. And yes, I have also seen when I work with this emotional aspect and psychological aspect. So yes, there is a lot of ease. And when we combine the physical motion as well, the physical domain as well to this, so certainly there would be phenomenal benefits to all these things. That's a beautiful thing which you are sharing. And I believe many women would get benefit out of this.
Right.
Srishti, now because you are telling so much interesting components, so now I just want to understand. You gave me two specific examples. One is of a specific surgery sections, and the other example, which mass majority of the population is facing. That's a pregnancy. But when you are dealing with both the kind of cases, so do you see any challenges when you are working with these kinds of cases? I'll not say patients, these kind of cases. Is there any
Right. So
resistance or they do not follow the instructions? Any challenges have you seen in this? Because definitely it is for the person's benefit. But
right.
even
So challenges, obviously there are challenges, because see when we talk about rehabilitation, they know कि हमने सर्जरी करवाई है, हमको एक्सरसाइज करनी पड़ेगी. And
okay.
most of the orthopedicians, when I talk about knee replacement, I would say 90% of the orthopedicians, they prescribe physiotherapy. कि also what happens is that जैसे आज surgery हुई, so it is known as day zero, technically day zero post operative. So that orthopedic hospital has a team of physiotherapists जो फिजियोथेरेपी करवाते हैं. जब वो डिस्चार्ज करते हैं ना, नी रिप्लेसमेंट अभी तो इतना एडवांस हो गया है दैट अगर वो डे 4 पे आपको डिस्चार्ज करते हैं, तो दे मेक यू क्लाइम स्टेयर्स, वॉक इन द कॉरिडोर, उतना करके वो आपको डिस्चार्ज करते हैं.
Okay.
सो देयर इज वन सेट ऑफ पीपल वो फील कि ओके, अब मैं सीढ़ी चढ़ने लगी हूँ, आई डोंट नीड फिजियोथेरेपी, राइट? ठीक है, it's fine. There is a set of people, there are a set of family members who know कि इतनी बड़ी सर्जरी हुई है, 4 दिन की फिजियोथेरेपी से फंक्शन ऑप्टिमाइज नहीं होगा. So they they will talk to the physiotherapist there or in their contact, कुछ भी करके वो कंटिन्यू करते हैं एक्सरसाइजेस को. कुछ ऑर्थोपेडिशियंस, कुछ ऑर्थोपेडिक हॉस्पिटल्स ऐसे होते हैं जो बोल देते हैं कि हमने 4 दिन करवाया है, आपको आपको आगे कंटिन्यू करना है. फिर वो आपके और आपके फिजियोथेरेपिस्ट का डिसीजन रहता है दैट कितने टाइम तक आपको कंटिन्यू करना है. सो दिस इज द सिनेरियो. ये रिहैबिलिटेशन में आपको पता है कि आपको करना है. कभी कभी ऐसा होता है दैट ये 4 दिन के बाद, there's a set of people who don't undergo physiotherapy, multiple reasons, but over a period of time they feel that there is some problem, कि स्वेलिंग नहीं कम हो रही है, या पेन नहीं कम हो रहा है, या मुझे मेरी डे टू डे एक्टिविटीज में अभी भी तकलीफ हो रही है. So now they know. Then again, there are two set of people. Someone will directly consult a physiotherapist कि हम मैं exercise कर रही थी तब मुझे अच्छा था. So they know that they need to go to a physiotherapist. Okay, they are sorted. There is a set of people. There are a set of people who will go to the surgeon जिसने surgery की है
Okay.
कि अभी ऐसा हो रहा है, अभी क्या करेंगे. So that surgeon most of the times they suggest कि आप 15 दिन 1 महीने exercise करो, you will be fine. But the major problem here is the time, right? आप सर्जरी के बाद खींच रहे हो ना, 3 दिन 4 दिन 5 दिन, you are delaying it. So that is a major challenge, because जब वो फिजियोथेरेपिस्ट के पास आते हैं ना, तो हमारे लिए हमको ऐसा लगता है ओके ओके आप थोड़ा जल्दी आए होते तो बेटर रहता.
Yes.
So that is again a challenge. And this is doable in rehabilitation, because we know they are going to come when I talk about surgery or any pathology or any ailment. ठीक है, बट जब हम रिहैबिलिटेशन प्रेगनेंसी के बाद बात करते हैं ना, सो मोस्ट ऑफ वुमेन who are not that much aware or who are not facing problems, or even if they are facing, वो ignore करते हैं उस चीज को. So eventually what happens after a period of 3 years 4 years, they bounce back. ठीक है, okay चल रहा है fine, but वो 3 4 साल के बाद they are bounced back fine, still not completely, they are ignoring things. बैक पेन कभी कभी हो जाता है, ठीक है हो जाता है, that kind of thing. But after a period of 5 years 7 years, they come with back pain, with predisposing, मतलब they have aged, a lot of other factors. इसी जगह पे if they must have taken physiotherapy postnatally, तो शायद ये नहीं होता. That is
Okay.
again lack of awareness, lack of, they don't know कि हाँ okay ऐसा भी करना होता है, that you postnatally need to visit a physiotherapist, right? So these are the challenges in rehabilitation. When I talk about prehabilitation is a different ball game. Because वो कॉन्सेप्ट ही अभी तक नहीं हुआ है. The people have not, they don't know, they are not aware. And I just want to quote a very interesting case of mine. I
Okay.
was treating actually, कभी 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 कैसा होता है ना, that if you knee replacement की अगर मैं बात करूँ, so कभी कभी ऐसा होता है that if you treat a patient with knee replacement pre habilitation में, आप सर्जरी डिले कर सकते हो. You, and I have done it. I
Okay.
have delayed, yes, we have delayed surgery. We have that patient has not undergone surgery till date.
Wow,
ऐसा है.
wonderful.
So so
लेकिन हाँ,
there
हम
was this
प्रेगनेंसी को
patient.
डिले नहीं कर सकते.
प्रेगनेंसी को डिले नहीं कर सकते, तो आपको प्रीहैबिलिटेशन करवाना ही पड़ेगा. कोई,
Yes,
so that
please.
it is for your ease. So there was this patient, and actually I was treating multiple females in their उनके घर में 3 4 लोगों को मैं ट्रीट कर रही थी. आई वेंट फॉर अ लेडी हु हैड वेरिकोज वेन्स, एंड उनको बोला था कि आप सर्जरी करवा लो, बट उन्होंने, बिकॉज कैसा होता है ना, वेरिकोज वेन्स की सर्जरी आपको फिर रिअकरेंट रहता ही है. सो शी वांटेड, हर डॉटर वांटेड कि आप फिजियोथेरेपी करवाओ उससे. सो that was a different case. We were doing exercises, she was doing well, everything. Then there was a relative of her uh, who was undergoing knee replacement, and bilateral, दोनों तरफ एक साथ. So what happened was, she was very adamant कि मुझसे पेन नहीं सहन हो रहा है, I want to go for knee replacement. But if you see the x-ray, it was grade 2 grade 3, तो आप उसको खींच सकते थे.
Okay.
But eventually, she underwent knee replacement without rehabilitation. She was very much adamant that I don't want to do exercises. I just want to go for surgery. And she underwent. Then it was fine. She underwent rehabilitation. It was all good. There was this another family member of hers, जो वो same घर में रहते थे. She had a very bad knee, I would say, compared to the one who underwent surgery. She was very adamant, मैं surgery नहीं कराऊंगी. I want to take a try. I want to do exercises. फिर भी अगर नहीं हुआ तो फिर देखेंगे.
Okay.
That kind of. उनको सबने बोल ही दिया था कि you have to undergo surgery, because even if you see the X-ray, even I was like ठीक है हम exercise करके देखते हैं. If you want to, फिर भी मैं आपको ऑप्टिमाइज करके भेजूंगी सर्जरी के लिए. We did physiotherapy for 8 months. She was a 75-year-old lady. We did physiotherapy for 8 months. She has not undergone surgery.
Wow.
She walks pretty well. There is no pain, there is no swelling, and she is very proud of her decision. And now she is like, देखा मैंने नहीं करवाया, so I'm fine. कोई जरूरत नहीं है सर्जरी करवाने की. She's very proud of it. She says this like this.
Wonderful.
And that हाँ, so प्रीहेबिलिटेशन का एक बेनिफिट ऐसा है कि ये जो ऑर्थोपेडिक सर्जरीज है, आप उसको डिले कर सकते हो. कभी
Hmm.
कभी ऐसा होता है कि जरूरत ही नहीं पड़ती है. ये नी में बहुत कॉमन है.
Okay.
Knee, and after that case, I have received 2 phone calls, people telling me कि हमको सर्जरी नहीं करवानी है, can you help us with that? I am working with those patients, and I am sure that they will not need surgery.
Wonderful. Srishti,
Right?
now you
So,
are telling
so challenge.
hmm. Yes, please.
So challenge यही है that she was aware कि ठीक है, this is also option, but वो awareness है ना, that is in a very less percentage of population कि
Hmm.
ऐसा भी कुछ होता है. So सबसे बड़ा challenge ये है कि awareness ही नहीं. And जब जब हम रेफरल सिस्टम की बात करते हैं ना, सो देर आर डॉक्टर्स हु विल रिफर कि आप एक्सरसाइज आके देखो, आपको ठीक नहीं होता है, फिर हम देखेंगे.
Hmm.
So that I feel that maybe it will take some time to develop और ये concept को adapt करवाने के लिए.
Srishti, मेरा क्वेश्चन ही यही है because in all these cases what I am seeing the major or I should say the most important challenge is awareness only. That's the thing which I am seeing in all your case studies. सो माई क्वेश्चन बिकॉज अगर हम ये कहते रहे कि अवेयरनेस नहीं है तो प्रॉब्लम नहीं होगी. सो आई जस्ट वांट टू नो फ्रॉम यू दो यू कीप ऑन राइटिंग अ लॉट ऑन लिंक्डइन बट आई जस्ट वांट टू नो फ्रॉम यू that what steps can be taken at individuals end. I'm talking about the whole physiotherapist fraternity here. So what steps can be taken at their end so that we can create a pretty good amount of awareness among people that yes, this is not just a therapy of exercises. Whenever you are having certain ailments or any disease or any kind of cervical issues or any
Hmm.
muscular or bone related issues, then only you have to reach when your issue has crossed certain levels. So, how this prehabilitation concept can reach to many people? What awareness strategies can be used?
Right. So basically what happens, awareness strategies में जैसे हम ये कर रहे हैं, that is also an awareness
Yes, I was
strategy.
about to think that.
So this is one form of that you use media communication, you do camps, you take seminars, and आप awareness करो जो हर एक, like it is like if I am conducting a lecture, if I am taking a, like just like this, doing a podcast or writing न्यूज़पेपर आर्टिकल्स, तो हम मीडिया और कम्युनिकेशन को ले सकते हैं एज अ फॉर्म ऑफ क्रिएटिंग अवेयरनेस. बट व्हाट आई फील इज ये हमने एट अ लार्जर लेवल किया. कभी कभी ऐसा होता है, सम पीपल विल नोटिस एंड कम टू यू और come to any physiotherapist, or they have it in back of their mind, okay, I heard the seminar, there's something that can be done. But what I feel is जैसे आपको भी पता होगा that ये परसेंटेज ना फिल्टर हो जाता है. People
Exactly.
don't remember it that way. So what I feel is जैसे what I do in my current practice is that if a person comes to me for consultation, जैसे भी आए हो, right, by referral of a doctor, by referral of a family member, whatever. So, and obviously, see, if I see a patient at their home or in the OPD, they are always accompanied by a family
Hmm.
member,
Hmm.
right? So, even more than one. So, basically, what happens is what I do, my first consultation session lasts for at least 45 minutes.
Okay.
I consult for 45 minutes. Sometimes it may exceed it. What I do in my consultation is जैसे आप मेरे पास इन अ वेरी लेमैन, इन अ वेरी नॉन मेडिकल टर्मिनोलॉजी, मेक यू अंडरस्टैंड कि आपको प्रॉब्लम क्या है,
हम्म,
राइट. आई विल एजुकेट यू कि आपको अगर पिंच, आपको पूरे हाथ में अगर झंझनाटी आ रही है तो क्यों आ रही है, राइट. That only a physiotherapist can do, what I feel, because we will be dealing with the patient in long run,
हम्म,
right. So that is my first point of consultation.
जी,
And secondly, what I do in my consultation sessions is I also take them through the management strategies. कि 3 दिन हम machines यूज करके आपका पेन कम करेंगे, फिर we'll start with mild exercises, moderate exercises. I also do it with reasoning कि मैं ये दे रही हूँ, मैं ये क्यों दे रही हूँ. Why this is important? Because if I make you aware of what you have, first thing you will have a sigh of relief कि okay,
हम्म,
उतना बुरा नहीं है, doable. Second, you will trust me that this person knows what she is doing,
हम्म,
right. And this takes up about 20-25 minutes of my consultation initially, which is followed by educating the patient and family member what not me, what physiotherapy in general can do,
हम्म,
and this of what prehabilitation is. आप कहाँ कहाँ किस किस चीज के लिए फिजियोथेरेपी करवा सकते हो. एंड मैम, यू वोंट बिलीव दैट इफ आई एम कंसल्टिंग दिस, मेरे 10 में से एटलीस्ट 7 पेशेंट ऐसा बोलते हैं कि ओ अच्छा, इसमें भी करवा सकते हैं, आई हैव अ
हम्म,
रिलेटिव हु हैज दिस प्रॉब्लम, मैं
yes,
उनको बोलूंगी कि वहां पे फिजियोथेरेपिस्ट को दिखाए.
हम्म,
एंड आई हैव गॉट few of my patients, अच्छा ऐसा है, मैं उनको भी लेके आऊं. So this happens, this is a real life scenario which I am doing day to day. ये मेरे
हम्म,
साथ multiple times होता है. जैसे मैंने आपको बोला ना, I'm seeing 3 patients in one home. How? This is how. So uh, this is what I feel a physiotherapist can do while consulting. Because मेरे practice में ये चीज बहुत देखी है, मैं मेरे students को भी ये चीज बोलती हूँ that you talk to the patient. Because what happens is, most of the doctors or most of the healthcare professionals, I'm not pointing out at any one healthcare profession, I'm
हम्म,
talking in general, they know. ठीक है, अभी आपको सर्वाइकल इशू है, मुझे पता है कि मुझे क्या करना है. ओके, आई विल टेल यू कि हाँ, मैं आपको पेन रिलीफ करवा दूंगी, मैं आपको स्ट्रेंथनिंग करवा दूंगी. एंड यू आर लाइक ओके, हो जाएगा, फाइन. बट इट द डिफरेंस कब आता है? जब मैं आपको एजुकेट करती हूँ कि मुझे आपको ये तकलीफ है, राइट. सो व्हेन आई एजुकेट यू, यू आर अवेयर and you know कि okay, see, I'll just give you one simple example. I have a lot of case studies to discuss because uh, I have a patient currently. She's a 62-year-old lady. अभी ऐसा है that उनके दोनों बेटों को they have this newborn kids. So she is very much into hustle. Now, she was my old patient and she had some ligament injury. She underwent surgery. तब उनको फिजियोथेरेपी नहीं बोला था डॉक्टर ने. She had ligament injury of the knee. एंड उसके बाद उनको नहीं बोला था. एंड दैट वाज इन हर यंग यंग टाइम. सब
हम्म,
रिकवर हो गया सब. फॉर द फर्स्ट टाइम आई कंसल्टेड हर फॉर नेक पेन एंड बैक पेन. उनकी जो डॉटर है ना, शी इज अ फैकल्टी इन माय यूनिवर्सिटी इन इंजीनियरिंग डिपार्टमेंट. So that is how she came to know me, and I consulted her for the first time, and she was on painkillers and everything. The first session, the first, it went for 3-4 months. She was fine. Then there was a reoccurrence after 6-8 months, because again there was a increase in workload and everything, and I was on vacation that time. And her daughter called me up कि मम्मी को ऐसा ऐसा है, आप कब आ पाओ. I said I'll be available after 3-4 days. And when I went, she told me, this is, absolutely what she told me, I'm quoting it. उन्होंने बोला that my family members will like, it was like इतना पेन है, फिजियोथेरेपिस्ट का वेट क्यों करना है, ऑर्थोपेडिक डॉक्टर, राइट. एंड शी सेड, क्या करेगा ऑर्थोपेडिक, मुझे पेन किलर देगा, मुझे नहीं लेनी है पेन किलर. मुझे ये पेन है, मुझे पता है कि मुझे टेंस से, अल्ट्रासाउंड से, एक्सरसाइजेस से फर्क पड़ेगा, मुझे ये पेन पहले भी आया है और ऐसे ही ठीक हुआ है, आई डोंट वांट टू गो टू ऑर्थोपेडिक बिकॉज दैट पर्सन इज गोइंग टू गिव मी medications, that person will give me painkillers, I don't want to do it. And this happened because she was educated, उनको पता था कि मेरा पेन ऐसा है, मेरा ट्रीटमेंट ये है, and she was fine within 1 week. So that's what I feel, that at a physiotherapist level, I just want to tell all the like the students and anyone who is watching, talk to your patient.
Wonderful, Srishti, wonderful. Even I'm having a bunch of questions to ask, but I know there is a time limit. We have to end this episode today. And that's the reason probably we have planned a series of this particular topic.
Series.
Because yes, this is for the mass audience, this is for everyone's benefit and for everyone's education. One important point which you are telling again and again in all your replies, that creating awareness, educating your patients, and not only patients, educating even each and everyone so that they can understand that rather than just filling up inside you, popping pills and putting the chemicals inside, just use your own strength. That's what I believe you are doing. That telling the person that you have this innate power, you have this innate mechanism inside you, which you have to use to heal yourself. And that's the beauty of our human body, so that we heal ourselves. And I resonate a lot with this concept of rehabilitation, because in all the sessions of life coaching, that is the only mantra which I always keep on telling to everyone, that this human body is miraculous. You have everything inside you, you just have to tap into that potential. And then you can heal anything and everything, be it as physical, emotional, physiological, psychological, at any level.
Yes,
Yes.
absolutely.
Srishti, I have to talk about a lot of concepts, deep down concepts about neuroplasticity and other concepts related to physiotherapy. But yes, certainly we would be doing it all in our next discussion, next session.
Yes,
And
absolutely.
for now, my last question, I know I've taken a lot of time because that's a
It's
very
fine.
interesting discussion. Just the last question I want to know, as you mentioned about your students, because you are a faculty as well in a university, and there are many young students who would be the physiotherapist, the future physiotherapist. So one advice definitely you have given them, that talk to your patients, talk to everyone, whosoever is coming in your vicinity. But other than that, any other message you would like to give to all those young physiotherapists, the future of our nations, that how they should take into their studies, what where they should focus when they are doing this particular course and particular studies? Any message from your side as a leader in this domain?
Like I keep on telling this to my students, and I literally hammer this. I would say that कि 4 साल बाद निकलो तो ये याद रखोगे. So it is basically what I feel, which is lacking in physiotherapy or in healthcare or whatever. जो वेस्टर्न कंट्रीज में बहुत प्रोमिनेंट है, that हम एक multidisciplinary team है. That if somebody comes to you with a neck pain, with a back pain, you are the point of contact. Very good, fine. But always keep in mind that orthopedic is a specialist, psychologist is a specialist, psychiatrist is a specialist, nutrition expert is a specialist. So आप हमेशा पेशेंट के वेल बीइंग पे ध्यान रखोगे. And always remember, you cannot do it all yourself. आप सब नहीं कर सकते बिकॉज आपने वो पढ़ाई नहीं की है. यू नॉट स्टडीड ऑर्थोपेडिक्स, यू नॉट स्टडीड न्यूट्रिशन, राइट? सो इट इज, I do this in my practice. I have contacts with my patients, orthopedician, with my patient neurologist, right? So it is very important that you have that concept that we are a multidisciplinary team working for the betterment of the patient.
Wonderful.
Right? There will be times that this case is now not in your hands, right? So you need referral, you need to refer the patient. भले ही वो फिर वो refer करके आपके पास वापस आए, right? और वो आएगा, the patient will, because you know you have to convey it very nicely कि यहाँ तक मेरा रोल था, इसके बाद if you are not getting better, I just want to tell this to this young minds that this will happen. There will be patients, आप अपना 100% दोगे, फिर भी there is something that they will not get better. So do not make the patient suffer. refer refer the patient, refer the patient to an expert, refer the patient. See, there are patients who have some psychosomatic problems, there are patients who have some psychological setbacks, right? Refer them to a specialist. What you can do, आप अपना स्किल दे सकते हो, यू कैन वर्क बेस्ट इन योर डोमेन, बट ऑलवेज रिमेंबर हम एक टीम है, एंड ऑलवेज फॉर द बेस्ट आउटकम ऑफ द पेशेंट व्हेन द टीम वर्क्स टुगेदर, एक तो पेशेंट कम सफर करे, पेशेंट विल सफर लेस, you will get faster results. Next time the patient will trust you better, right? I have referred a lot of my patients to neurologists, a lot of my patients to orthopedic, कि ठीक है, now I feel that this is the problem, kindly work on it, kindly cross check, or so that happens. This is one thing. And secondly, what I want to tell these students or this young mind is, as the body has a lot of potential, even you as a physiotherapist has immense potential, because we work without medication, we work without surgery. But always remember one thing, that you should never stop learning. 4.5 साल का कोर्स हो गया या मास्टर्स 6 साल का कोर्स हो गया, now I know everything. Moment you say I know everything, you are done with it, you will not grow. So keep on reading, keep on researching, keep on getting to know new techniques, so it will be better for your patient and your practice.
Wonderful, Srishti. And one, I would just end this particular episode with one of your quote only. That just hit me too much. Do not let your patients suffer. Let refer. That's a
refer
beautiful thing which you are telling. And undoubtedly, that a person should always be a lifelong learner. If you want to grow in your career, you have to be a lifelong learner. So that's a wonderful discussion, Srishti. And yes, we have just, I believe, we have not even scratched the surface of this particular topic. We have to go deep down into this topic. And for that, we need a continuous awareness session, continuous educating session, so that your purpose is also getting solved and the people are also getting benefited out of this wonderful discussion, which is so meaningful, so insightful. So for today, thank you so much, Srishti, for spending a lot of time in educating and creating a lot of awareness for this domain. Thanks a lot from my side.
Thank you so much, ma'am, for having me. I just look forward so that we can do some exciting sessions and take this ahead.
Yes,
Right.
definitely. Thanks a
Right.
lot.
Thank you, ma'am. Thank you.